Welcome to another video from Rising Health. Today, we're going to talk about a crucial topic that everyone should understand to avoid serious consequences. Pay attention to these 10 critical warning signs before a stroke. Don't ignore these symptoms, as the information we'll share could be the thin line between prevention, intervention, irreversible consequences, and even death. Stroke is a medical condition that occurs when there is a disruption in blood flow to a part of the brain or when a blood vessel in the brain ruptures. There are two types of strokes. Ischemic stroke, which accounts for about 85% of cases, occurs when a blood vessel supplying the brain is blocked by a blood clot. And hemorrhagic stroke, which represents about 15% of stroke cases, occurs when a blood vessel in the brain ruptures, leading to bleeding in the brain tissue. Anyone, regardless of age or gender, can have a stroke. However, certain risk factors such as advanced age, family history, high blood pressure, diabetes, smoking, and obesity increase the likelihood. The signs can vary, and the onset of symptoms can be rapid. In some cases, symptoms may appear suddenly, while in others, they may develop over hours or even days. A stroke can occur at any time without warning. Therefore, it is vital to be aware of the signs that the body may emit before it's too late. Can you recognize the signs before the clock starts ticking? Let's explore together the signs your body may show indicating that immediate intervention is needed. As soon as you notice these symptoms in yourself or others, seek help and medical attention as soon as possible. Sudden weakness or numbness on one side of the body. Imagine arteries as tubes supplying blood to the body. If one of these tubes is blocked by a clot or ruptures, the area of the body supplied by that blood vessel is deprived of oxygen. If the affected area controls movements and sensations on one side of the body, it can result in sudden weakness or numbness on that side. For example, a person may suddenly notice that an arm or leg does not respond properly, possibly leading to the dropping of held objects. Sudden confusion or difficulty speaking. Sudden confusion or difficulty speaking occurs because brain cells cannot function properly without oxygen. Difficulty in speaking arises due to the disruption of efficient communication between the brain areas controlling language and the muscles involved in speech. Examples of sudden confusion include sudden disorientation, difficulty understanding speech, and loss of the ability to express oneself clearly, while difficulty speaking can manifest as slurred speech, inability to form words, or even complete loss of speech. Sudden vision problems or blurred vision. Sudden vision problems or blurred vision occur when the brain or eye area is deprived of blood and oxygen. In the case of the eyes, interrupted blood flow can result in blurred vision or even partial loss of vision. For example, a person may suddenly notice that vision in one eye is blurry, as if a curtain has been drawn over it. Sudden difficulty walking or lack of coordination. When communication between the brain and muscles is disrupted, it results in difficulties walking or lack of coordination. For example, a person may suddenly have trouble maintaining balance, stumbling, or even being unable to coordinate limb movements, giving the sensation of being drunk. Sudden and severe headache. Imagine arteries as tubes supplying blood to the brain. If one of these tubes is blocked by a clot or ruptures, pressure inside the brain increases rapidly, resulting in a severe headache. This headache differs from a common migraine in terms of intensity and sudden occurrence. For example, a person may describe the pain as the worst headache of their life, and it can occur without warning. Patients report a sharp and debilitating sensation, often accompanied by other neurological symptoms like those mentioned earlier. This symptom requires urgent medical attention, as the rapid identification and treatment of a stroke are crucial to prevent significant and potentially fatal brain damage. Sudden difficulty swallowing. If a region of the brain responsible for this function is affected by a lack of blood due to a stroke, communication between the brain and the swallowing muscles is impaired. This can result in a sudden difficulty in swallowing food or liquids, potentially leading to choking or even aspiration. For example, a person may suddenly realize that swallowing becomes a challenge, causing discomfort when ingesting food. Some people may experience what is known as a transient ischemic attack or mini stroke. Transient ischemic attacks are temporary episodes where stroke symptoms may occur for a few minutes to a few hours and then disappear. Although transient ischemic attacks do not cause permanent damage, they are considered a warning sign that a full-blown stroke may occur soon. If someone experiences symptoms such as sudden weakness on one side of the body, difficulty speaking, blurred vision, or other symptoms associated with a stroke, even if these symptoms disappear quickly, it is crucial to seek medical attention immediately. Early diagnosis and treatment can help prevent a more severe stroke. It is rare for stroke symptoms to manifest significantly in advance, like a month before. Typically, strokes have a sudden onset, and symptoms appear acutely. However, some underlying medical conditions, known as silent strokes, can increase the risk of a future stroke and present milder or less noticeable symptoms over time. Let's now explore some of these symptoms. Recurrent dizziness or vertigo. These sensations can result from disruptions in blood circulation in the brain, and it is crucial to recognize specific signs for early identification. For example, if dizziness is accompanied by difficulty balancing, impaired coordination, or spatial disorientation, these may be concerning indicators. Intermittent vision problems. These visual issues may include episodes of blurred vision, double vision, or momentary loss of vision in one or both eyes. Episodes of temporary confusion or disorientation. This confusion can manifest in various ways, such as difficulty remembering recent events, disorientation regarding time and space, or even momentary lapses of memory. Identifying associated signs is crucial for recognizing the severity of the situation. Persistent headaches. Persistent headaches can, in some cases, serve as a subtle and less noticeable symptom of a possible stroke. These episodes of pain can often occur days before the stroke, and it is crucial to be attentive to specific characteristics for early identification. Associated symptoms, such as changes in the intensity of pain, atypical location, accompanied by blurred vision and dizziness, can be indicative of greater severity. It is crucial to emphasize that these symptoms can be caused by various medical conditions and do not always indicate an imminent stroke. However, if someone experiences any of these signs persistently or severely, it is essential to seek medical attention immediately for proper evaluation and diagnosis. Regular medical checkups and controlling risk factors are fundamental in preventing strokes. When the consequence of a stroke is not fatal, resulting in death, some damage to our body can occur when rapid and effective intervention to reverse the stroke is not done. The most critical damages include total or partial paralysis of the body, loss of total speech ability, and severe cognitive impairment, resulting in significant memory loss or even dementia. In milder cases, damages may include muscle weakness or paralysis in a part of the body, or a person may have difficulty lifting or moving a limb, difficulty finding the right words or forming sentences, difficulty solving simple problems or maintaining concentration on a task, changes in emotions, or alterations in sensory perception, such as vision, hearing, or touch. If you or someone close exhibits these critical signs of a stroke, it is necessary to seek the help of a qualified doctor quickly. Time is a critical factor in stroke treatment, and rapid interventions can help limit brain damage and improve recovery chances. We appreciate you for watching this video until the end, as it is crucial for everyone to be aware of these symptoms. Therefore, we strive to provide the best informative content for you. If you enjoyed this video, click the like button, subscribe to the channel, and activate the notification bell to receive our videos firsthand. These simple actions help increase the visibility of our channel. Also, check out other videos here that may be important for you to stay attentive to your health and the health of those around you. Share this video to raise awareness in emergency situations. Take care, and until the next video with more healthy tips.